Annie Edie,
Present.
Selwyn Hicks. Selwyn Hicks.
He's in Algonquin Park.
Heading with the
Probably
Bears
won't
and the
hear
Black
me.
Flies.
Lori Laporte.
Present.
Paul McQueen.
Present.
Brian Milne.
Present.
Brian O'Leary.
Present.
Sue Patterson.
Present.
Chris Peabody. And I believe Nick Saunders is also present.
Chris is on the phone.
Oh, is he? Okay.
Yes.
I didn't hear him. So he's here then? Okay.
Yeah.
Present. Can you hear me now?
Yeah.
Yeah. Okay. Okay. All right.
Can you name on phone?
So Sue, are
Nick Saunders.
you put the agenda on the screen?
I need to share my screen. I can't find it. I don't know if I have too many things. Oh, here is this. I think this is it here. Share.
Good, perfect. Okay, are there any amendments to the agenda this morning?
Mr. Chair, if we can add 9.3 first responder resilience training for local political leaders.
Okay, thank you. Any other amendments? Mover and seconder to approve the agenda as amended? Sue, Brian, Millen? Is anyone opposed to that amendment? Hearing none, I will consider the agenda as amended passed. Approval of the agenda, we just did that. Disclosure of pecuniary interest at this time, or if it rises down the agenda. Adoption of the minutes from Friday, June the 26th, the BOH Executive Committee minutes, July 10th, the draft BOH Executive Meeting minutes, October 16th, and the draft BOH Executive Meeting minutes, August 23rd, 2019. Can I get a mover and seconder to get it on the floor?
Edie.
Larry.
Edie and Leary. Are there any errors, omissions, or discussions from any of those minutes that have been presented?
I had a question, Mitch, if I might.
Yes, sir.
Why are the executive meeting minutes, why are they coming to our board meeting now? And it seems, you know, at least a couple, well, three of them are quite, well, two of them are quite tardy coming. What happened there?
So, Mr. Chair, if I may answer, we have an item related to this and the others, and the discussion in camera would cover part of that as well.
Okay, thank you.
Any other questions or comments? Anyone opposed? Hearing none, I will consider the minutes approved as presented.
Excuse me, Mitch. I just wondered, I thought, didn't somebody ask that we see the minutes of the executive committee going forward, or was that just, is that just a one-off? I was just trying to remember.
Dr. Ayer?
So we usually bring minutes from the executive committee in groups. Historically, they didn't come right away. There was a couple discussions. One of them in camera was related to the executive minutes and the need for approval for them. Again, I can probably provide more discussion in camera.
Okay, thanks.
Okay, correspondence and news releases. Can you scroll up just a little bit, Sue, please? Thank you.
So, Mr. Chair, we talked last time about having a summary for news releases and more breakdown of information within the report. And if there are any questions about the correspondence on the news releases, we'll be more than happy to answer. In short, the 3 correspondence come from the same health unit run through, and one of them is related to food basic income and income security during COVID. The other 2 are related to modernization and funding of public health. All 3 of them have been supported by the health unit before, so our recommendation is to receive.
Okay, so you've seen the list of correspondence and news releases. Is there any comments or discussions on any of those releases?
Mr. Chairman, it's Al. Just on 6.2.12, the international visitor, I was just wondering on that, is it a ticketable offense or is it an issue where that international visitor has to appear in court?
So it could be depending on a level of offense. In this case, it was 3 charges, I believe. One of them is related to the Quarantine Act, federal charge, but the OPP can lay charges or a fine, and it's $1,000 ticket. If the person did not comply, there could be further action, including court appearance.
Okay, so I guess just to be clear, so the person did get then $1,000 fine to start with, and then there could be more if they don't obey.
Correct. They received the 1,000 ticket and 2 other charges as well. There were multiple offenses in the same interaction.
Okay, good. Thank you.
Any other questions or discussions? Okay, seeing none, a mover and seconder to receive the correspondence and news releases as presented.
I'll move that.
Laporte,
Mr. Millen and Lori. Anyone opposed? Hearing none, I will consider those accepted. Dr. Era, MOH update.
Sorry, I don't know what happened there. If you can bring back that camera. Sorry. Am I in control here? Okay. So MOH update, Mr. Chair and board, is related to investigations in public health and safe reopening of schools in Grey Bruce. 2 subjects that intertwine in many ways. Disclosure, the objective is the first one, to have better understanding of case management, contact management, outbreak management, and outbreak investigations. Technical terms we mention, and throughout the emergency we have deployed, we have looked at different understanding from the public about this, and everybody knows contact tracing, but some of the public might think it is just a phone call. So we thought if we present this, it will be disseminated in different channels, provide more understanding to the public what we do here. And the second objective is to provide better understanding of safe reopening of schools and the collaboration between the Grey Bruce Health Unit and the schools in our area. So case management, contact management, outbreak management. These are robust protocols, have been in public health and refined over the years during SARS and the preparation for Ebola. And currently during the current outbreak, we have deployed them. They have multiple facets, whether it's medical, legal, ethical, social, And in the next slides, you would see how they actually affect multiple levels, and they have all these facets built in. All of this done under formal investigation, and it is done in a way operating in the public arena. However, there is the privacy part of it is ensured, which makes it even more delicate. To me, it's more elegant procedures. Supporting the patient and preventing transmission. So it all starts with the diagnosis of COVID in a lab. And by law, every lab in Ontario would have to report to the local medical officer of health where the patient's address is. And when we get this report, usually within minutes from the diagnosis in a lab, the infectious disease team would, sorry, our screen went down, but if you can still see the screen from your end, that will be.
We can still see it, Dr.
Thank you. So the team would follow up with the patient, and as you would appreciate, a diagnosis of COVID is not an easy diagnosis to receive. So there is a sympathy, empathy, and support, providing medical information and the direction to manage the case, but also to ensure no further transmission happens. And this takes place through really complex process. It's not just a phone call, like I mentioned, and it requires specific expertise in conducting these interviews. One of the aspects of it is to ensure reliability of the information. Yes, we want to support the person, and we definitely want to build trust, and that trust is built over multiple calls. We call the person every day for 14 plus days. We get information from them, where they have been, what they have done, who they talk to, and assess the risk in every interaction. Then we will contact the people who might be at risk from that list that was generated in the interview. And we would assess, cross-examine the two sets of information to ensure reliability. And there are many challenges, whether it's related to memory. There are some people would have memory issue or non-compliance attitude issue. Luckily, it's a minority of cases. In these cases, we can ask our staff to follow up with the person in person or escalate it to engage enforcement agencies and the police. There are other barriers there as well, language issues and access to phones issue. For example, the cluster on a farm with seasonal workers, the group didn't speak English and they did not have access to phones. So we would lend phones during the period of isolation, and we can use language translation through PHO and interpretation. And it has been very timely successful. There is utilization of technology, where we get right now 116 cases. Each person worked in a workplace or multiple, and they attended different settings, whether it's a restaurant or others. We record all this data, and we've been working on how we can cross-examine this data electronically. So a red flag will go up if two people had attended the same spot, or to be able to have epidemiology link among these cases. Privacy is another issue, and that could be legal depending on the situation. Although we operate in a public arena, we ensure the privacy of individuals. And because if it's a small rural setting, sometimes small communities, people assume that everybody's going to know about them when they have a diagnosis, and generates a lot of anxiety. We reassure people that whenever we contact the case, we will get this information and call the other contacts. However, the name of the case or any identifier is not going to be shared. Other people would receive the call saying you have been exposed to COVID, not you have exposed through person X. And sometimes, even if it's a workplace where there are 5 people, 1 case, and 5 contacts, we get the question from the client, how can you ensure I would not be known? And sometimes they actually release the information themselves, which is their right. However, it creates more complexities. And in that case, if there are 4 people exposed to 1 case in a workplace, the next step in management, all 5 will be isolating. So people would leave the workplace, but nobody would know who the case is unless it is the case themselves, if they don't release that information themselves to other people. Early in the outbreak, when numbers were less than 30, we did not release the location of the town for multiple reasons as well. Privacy is one of them, practicality the other, the potential stigma to a community. Workplace investigations, as I mentioned, 116 cases right now. We have, most of these people work and sometimes work in different workplaces. And we do actually manage these workplaces' potential transmission. The Ministry of Labor is responsible for safety. And when it comes to safety related to infectious disease, usually public health is the lead agency, and we collaborate with them. It has been in every single scenario that we went through, there has been 0 transmission to another coworker or a client of a business in the commercial part. The only transmission that took place was in the long-term care, which is, again, it could be viewed as a workplace in one aspect or the other. And early in the outbreak, there was not universal masking for long-term care. However, the main reason where there was transmission in that workplace was the fact that that long-term care had dementia, patients with dementia, with high proportion of patients have dementia that does not allow any recommendation other than cleaning and cohorting or other interventions, but there was no compliance. If you exclude that workplace, every other situation, we were successful in preventing further transmission. They are powerful tools, these interventions, management, case management, contact management, and outbreak management. If they require a team of professionals, and if implemented right, appropriately, like they have been in our area for this pandemic, we all yield the benefit of preventing transmission, of benefit of safety to individuals, families, and community. They allow us to keep healthy people healthy. And in Grey Bruce, there were 2 cases that required hospitalization. So literally the healthcare system has been here for testing, but not for treatment. And they have been our insurance policy. And we're grateful that they are ready if there is a second wave and we have not been able to control the outbreak the way we have. This is a cluster analysis was done by Dr. Lee and a resident who was with us during April and part of May, a resident from family medicine who did a rotation with the health unit and myself and Dr. Lee. So you would see here, Mapleview is the long-term care where there was transmission. Shelburne is an outbreak in a workplace, but it's not in our health unit. However, the 3 cases, case number 78, 81, 92, and these are internal numbers to deal with cases and follow up with these investigations. These 3 cases live in Grey Bruce and they work in a different health unit where they acquired the disease in that workplace. The rest, and I think here it was up to 95 cases when this cluster analysis was conducted. You can see that the transmission from one case to other cases in Grey Bruce has been very limited to very few cases, but not workplaces. Another So what I mentioned so far has been case management, contact management, and potential outbreak management. And in long-term care, it's outbreak investigations and management. The coming 4 slides, just to show the increased or the complexity of outbreak management, which is a step further to everything I mentioned. And it could be at the level of, a school, an outbreak in a school, or long-term care, or a hospital. I neglected to mention that we manage outbreaks in hospital as well. And there was a potential outbreak in one of the hospitals that we conducted very appropriately. And now we have the luxury of looking back with few weeks, and there has not been secondary transmission past the initial diagnosed cases. So whenever we're dealing with outbreak investigation, it is a very complex process. And it's, again, like when I say complex, to me, it's a beautiful process. It's when the team is going through it, and it's not iterative in any way. Any of these next 12 steps would repeat and go back to a previous step. And there is dynamics to it that makes it very robust, very, very powerful. It starts with confirming the diagnosis, and not just diagnosis of a case, it's diagnosis of an outbreak. And that's the definition depends on the setting. In long-term care, we have very low threshold. Any case is considered an outbreak. In hospitals, as you would appreciate, there are going to be cases anyways. If it's a hospital in Toronto, it would have 6, 7, 20 cases of COVID. So we cannot call it an outbreak just because people go to the hospital. There should be transmission in the institution that caused infection of no cases and 2 or more cases. And it's different from setting to setting. We would assemble a team, and the team has been assembled since March, since this is a pandemic. And we go through the next step, implementing control prevention measures. So if it's a long-term care, it would be the cleaning, the isolation, the cohorting, putting signage up. And that's on its own a protocol that will be ignited through this step or initiated through this step. The next step would be define a case and begin case finding. So that's a case definition that was very wide or very narrow early on in the outbreak, and it changes to actually allow the management of the outbreak to capture different group of the population, depending on the level of risk in these groups. When data is collected, you would look at the epi curve, and there are different types of epi curve and signals in the epi curve. Determine who's at risk of becoming ill to basically be ahead of the curve and try to mitigate. Sometimes we use a generation of hypotheses. So this is probably not as applicable to COVID. However, it could still be. If we're dealing with a bug, we don't know what it is. Is it salmonella or other bug? We need to start generating hypotheses. Where is the source of the infection? Is it in the incidence of COVID? Is it a specific person? Is it staff? Is it resident? Is it a substance that's used, for example, in a meat factory? It could be the meat that the substance that they work with is actually the source of infection. It could be specific machine. So we generate hypotheses and test them and do more inspection and testing. And we go back to different steps of the outbreak management to control it. And the main goal is to stop the transmission and go to the final step of declaring the outbreak over and writing a report that would be disseminated. And based on the report, usually more refinement of the protocol will be done. Again, this is just a snapshot of what we do with these interventions, and we can utilize them in many sectors. One of them is the school sector that we all are working on at this point to ensure safe opening in September. And the Ministry of Education has asked school boards to come up with different plans and submit them and work with public health to ensure these plans would reduce the risk of transmission, would allow for safe reopening. Here are some examples of, or some aspects of this reopening. It will be voluntary, so parents would have the option to send the kids to school or to send them at a later date, or just choose the option of the kid learning at home. And each plan would allow for providing the education and part of the social experience through online or in person, or a combination of both. So the three plans that the schools are required to provide is normal school day, the traditional, everybody would go back to school. And the third one is exactly the opposite side of the spectrum. Everybody would study remotely, and in between, modified school day routine, which could be alternating days for certain kids or alternating days for certain classes, combination with online and others. So some of the adaptations of school environment would be related to limiting visitors and parents, considering signage, minimizing the number of persons in specific setting, develop guidance for lunch and lunchroom. And like any business or organization has many activities in its, schools tend to have even way more complex activities. And the other aspect of it is related to childcare as well, and before and after school. And we work with both sectors to ensure this would happen safely. Practically, we started meetings bi-weekly with every executive from, executives from all schools in Grey Bruce. And we have a second bi-weekly meeting with the 3 big district schools. We are streamlining all services that we provide through one program, school health. That might allow us to have more flexibility, maneuverability, and control in providing services to this sector. From the French emergent, I believe, Director of Education, they mentioned that they deal with health units from Windsor to Grey Bruce. And again, we must be doing something right. We are the first health unit that actually organizes this proactively to connect with schools. I have no doubt we will be able to serve this sector similar to the other organizations that we have served over the past 4 months. The rules of public health in this sector are similar to other organizations. And as I mentioned, the capacity to conduct case management and contact management is key. And here's a list of other interventions. I mentioned this in a previous presentation to the board last month and probably the months before. Communication, the bottom of the list, is probably the most powerful and requires delicate approach and high level of engagement from the team and the public. There are different aspects of what we do as well, would apply to every other organization. And those are the references. Any questions, Mr. Chair or board?
Thank you,
And
Dr.
I do
Barrett.
have a question. One of my concerns, I've been hearing about this going back to school. And I think it is, can you still hear me? My picture's off here, but.
Yes, we can hear you.
I'm very glad right now that my teaching career is behind me, because I can't imagine doing a combination of online and alternating days. So first of all, alternating days, the only experience I had with snow days was in Ripley. I was there a couple of years. The rest of the time I was in town. We didn't have hardly any snow days. But I found with snow days, so they came on Monday and you usually started your week, you had some, a bit of review, but you taught a few new concepts or whatever. Then they wouldn't be there for Tuesday or Wednesday maybe. Come Thursday, it was like Monday didn't exist, or they wouldn't be there one day. You just had to start over again with a lot of kids. Your kids, that would learn in spite of you, that they do well, but I am really worried about the kids. Some of your average kids or your kids with mild learning disabilities or disadvantaged homes. That is my big concern. I would sooner see everybody go to school for 4 days and on Fridays catch those, take those, this is just a wild idea, I know, but take those children that are struggling, because you have to take into account, say you missed grade 3 last year, from March to June. That's a big chunk for your average kid to catch up on, let alone those that have mild learning disabilities or other IEPs or things like that. If they need some individual attention. And so if you had a class of even 10 or 12 or whatever on a Friday, maybe some of them could catch up from last year. Like certain grades you miss are so key. That is my concern. And alternating days does not serve that part of the school population well at all. So I'm just throwing that in there. I think that's a huge concern, considering the amount of school they missed, especially in Grey Bruce. You have to remember, before COVID, there were strike days and things like that. So from January on, it was pretty haphazard. So that's essentially, when you teach a class, depending on your class, you do review in September, October, and introduce a few new concepts. But after that, you start to get into your new work. So, and you push straight through, you're trying to meet the curriculum deadlines by the end of the year. But those kids didn't get the meat of the year. So I feel sorry for the teachers and the board and some of those kids that are going to really struggle catching up. But I'm sure they'll have programs to catch up. But I really think they're going to have to put more educational assistance in if they go to a normal return, which I think is good for the socialization. Young kids need to be socializing and running around outside, playing. I hope there's not too many restrictions on the playground that they have to stand in, only can play in a box or something. It wouldn't have enough playground equipment to socially distance, or some playgrounds just aren't that big for socially distancing. So good luck with that, Dr. Rera. I commend you for advising them, but it's a balance between children's development and catching up and controlling COVID-19. So and daycare. I hope that people are up to that challenge, and it's such an unexplored area that you'll start off in one direction and just have to wing it sometimes, I'm sure. Sorry for taking so long, but it is a major concern. I'm very concerned about those children. I can't imagine having children, especially in this day and age, where they won't ever give them an extra year to catch up. Having enough time to catch up. And I've seen studies with children that feel they're not succeeding in school, they're way behind, they give up. And then as teenagers, they're the ones that give up, get in trouble with the law. There's a far higher percentage of them go down the wrong path unless they get extra help through, especially elementary school. Sometimes by the time you get to high school, if they're not on a good track by 7 and 8, then high school is too late. Just my observations after 25 years teaching, Dr. Era.
Mr. Chair, if I might.
Yes, sir.
Ann raises some very good points there, but I'm just wondering from Dr. Era, I'm not sure that's our concern. I mean, it is a concern, but I'm not sure it's ours. That's the school board's concern. It's Dr. Era's concern to make sure whatever plan that the health or the school board comes up with is safe. Am I understanding that correctly?
So thank you for both comments. It is actually, our concern is the balance of them. The control of COVID is definitely our mandate. It's mainly our mandate. Sorry, not mainly. We are one of the few agencies, and we're the lead agency for this mandate, ensuring well-being of the kids and their mental health is also our mandate. So balancing both is probably would be the success going forward. And I share with Mayor Edie all the concerns that she mentioned, and she really touched base on almost every part of the concerns that we need to examine to ensure moving forward in a safe reopening. The goal, the option of having full return probably is the option that we will go with if all the epidemiology stays the same, all the other variables stay the same at this point. We have full control over the outbreak that would allow us to have that option that's most preferable for both, for ensuring well-being of the kids and their education and their social life, and at the same time provide all these things in a safe way. If I may elaborate a bit on this, most people think it's an on-off switch, shut schools, open schools, or open. It's actually a dimmer dial approach. It's really depending on many variables at the time. And it's difficult to say right now, mid-July or end of July, to say 1st of September, we're going to do this. And that's why we prepare 3 plans to have full return if everything stays the same, to have close to full closure and online teaching if the situation was very drastic, and a plan for in between. And the modified plan is really not one option, it's rather a spectrum. It would be great success to say we have 0 cases in schools by the end of the year, but it would be not a success if there are 2 kids who committed suicide because of depression. Like Mayor Edie mentioned, the long-lasting effects. Most of us have strong experiences in life, and we're able to control our environment, be aware of our mental health, and still we have stress with it. For kids who don't have the previous experience with life, this experience is drastic to them. They don't understand it. There are certain reports of kids around 10 years old just crying. They haven't seen their kids. They don't understand why. So again, if it goes for longer, that's gonna affect their mental health, and the consequences would be in 10 years, 15 years, not necessarily tomorrow. Another layer of consideration there, I don't know if Mayor Edie touched base on it or not, but it's related to equity. Kids who come from from families that are able to provide education at home, parents who can teach the kid, parents who have time to teach the kid, they will do better. Kids who come from families who don't have these abilities, they will suffer dearly. And there is clear evidence by the end of the summer, 2 months or 3 months of summer break, usually the grammar knowledge and the math skills that are gained during the springtime are usually lost or partially lost by the end of the summer. And they're lost more often in kids who come from families that cannot provide family environment that supports learning. So if 3 months summer is affecting this group disproportionately, if going forward with complete closure might be drastic, or which is the online option, or even the modified. So I agree that we need to, the best of our ability, keep that sector as open and as fast as possible, as long as it's safe. And thank you for the wishes, Mayor Edie, to deal with the challenge. We're up to it, definitely. The team has been up to it. We have the knowledge, and more importantly, the compliance is probably not the right term, from the public. The public has been informed, has been following the recommendation, has been following the local political leaders, yourself around the table, and that has been our success. So completing that answer, I need to go back to the second part of it. It is truly it's our mandate, both of the issues, the well-being of the kids and controlling the COVID. However, we are the lead agency, or maybe one of the very few agencies that deal with controlling COVID. And that really puts that onus on us. If the system did not work with preventing a second wave like the way we prevented the first one, it's going to be on the health unit, because we are the center of it. If on the other side, the system did not succeed in providing open education and social experience to the kids, it is on many partners, including us. So I see wisdom in both suggestions from Mayor Edie and Mayor Mellon.
Other comments, questions? Dr. Will each child be tested for COVID before going to school?
There is no recommendation for that. It wouldn't really. I realize that there is a drive for testing everybody. However, testing should be based on symptoms or exposure to previous cases. And it would not be required unless there is one of these two reasons at the time. If there is an outbreak in one of the classes or potential outbreak, it will be a recommendation to test everybody in that class and ask them to isolate. However, it would not be prerequisite to going to schools.
Yes, because that was definitely one of the discussions I had with one of the parents that, and I know what you're saying, so I'm glad you could reiterate that. So,
Mitch,
yes.
can I ask a question? Dr. It's Chris Peabody. So yes, I agree with Mayor Edie's about how important this is and how much anxiety there is in the community. So thank you very much to your staff for taking this on. Former teacher, I can't imagine having to deal with this file. It's so complicated. So for the parents, Dr. A, you're working on 3 scenarios, and which option you pick will be based on the epidemiology. Is there a sort of a timeline where you'll make that decision for the parents?
So it will be decided, again, similar to everything we've been doing in this emergency. We have the ability to see 1 week, 2 weeks in the future to predict what's going to happen. So right now we will prepare for all scenarios. And as we go into the school year, we would modify these recommendations based on the epidemiology, based on the compliance and other variables. I suspect if we're going to see any change in major epidemiology, it would be late September, October, when the weather gets cooler and the schools have been in operation for a period of time. Usually in pandemics, from the literature, in the reopening, many parents would be reluctant to send kids to school from the get-go. They just want to watch and evaluate. So we would anticipate that although the recommendation, let's say at the time, is to open the school completely and, with the frequently cleaning and the social physical distancing to the best of their ability, however, everybody goes to school. We will see, I have no doubt, we will see many parents saying, I'm not going to send my kids until 3 weeks, 4 weeks. So we will have to go probably with the modified approach just because the kids are not there. However, all these decisions will really happen in real time at that time. Does that answer the question, Mayor Peabody?
Yep, that's good. And so good luck to your staff. Certainly you'll have my support in whichever option you choose. It's just had I think the most complicated decision I've ever seen.
To that end, and it's really related to Mayor Millen's comment, a direction from the board about the level of risk that we need to tolerate might be stopped at the time. We can always shut it down completely, send everybody home with online, and that will ensure that the Board of Health and the health unit has succeeded in preventing COVID, but again, on the expense of other things. And I will definitely go to science to make these decisions. Having said that, I'll update you at all times about the potential level of risk. In September, if everything stays the same, my recommendation would be that the whole school can go back, and we will observe and monitor and do everything we can to ensure that would be safe. Similar to what we've done in stage 1 and stage 2, we didn't really restrict further to many businesses or any businesses. But at the same time, we're risking that there will be cases of COVID here and there. Hopefully not outbreaks. If we do our job right, it would not be outbreaks. And again, back to my point is, there is the reputation risk for us if we go more open than other health units based on the good results that we have. And it is our mandate, both sides of the equation are our mandate. However, it's the bigger mandate is preventing COVID. Just a comment or information for the board that I'll keep you updated about it, and I might consult with you at junctures that might become tricky.
Okay, other comments or questions for Dr. Era?
Mitch, it's Al. Dr. Era, the Premier has said it's going to be up to each local school board, which at least some discussion anyway, as to which route they're going to go. Through your contact with the other MOHs around the province, do you hope that there's a unified message going forward, or do you think there may be some that will go with one option, whether it be the full-time going back to school or the hybrid? Do you have a sense from talking to other MOHs what direction they might go?
So again, there is unified approach in the knowledge that we know our role to work with the schools and to make these decisions. I have no doubt it will be different approached in different areas based on the dynamics of the outbreak in that area. Like we have in Grey Bruce have worked really hard, all of us, the health unit, the public, the different levels of government, to ensure the good results that we have and to be able to to be able to yield the benefit of opening schools, for example, for our kids fully. This might not be the same case in different areas, and this might not be the case for us in 2 months from now. So I have no doubt it's going to be different approaches, and it's built in the recommendation to have different approaches, like you rightly said. It will be depending on local need.
Thank you.
Nick Saunders raised his hand, it says.
Oh, okay. Nick? Can you hear me, Nick?
What was?
It said maybe he clicked on it by mistake.
Okay.
Is he unmuted? I'm asking Connie. Okay.
Okay, any other questions or comments for Dr. Era and his report? I too want to thank you, Dr. Era, you and your team. This is, as Chris said, it's a big topic. It's going to be very challenging, and I know the health unit's up to all the issues you're going to be facing. So it definitely is. Like I said, I've talked to some parents that are deeply concerned, and rightfully so. But all we can do is assure them that we're trying our best to help their little people and have everybody as healthy as possible. So again, thank you very much for all of your involvement in this. Now I can't speak in the computer. My computer doesn't allow it. This is from Nick.
Mr. Chair, if I may just add 2 quick points. One of them from Mayor Edie's more or less question about playground. The goal is to keep them open with increased cleaning. And if the situation stays like so, it would be opening playground with increased cleaning only. The second point is related to masks. There has been a question from schools and from the parents, are you going to mandate masks in schools? And if we continue to have the relatively positive results we have, there will be no mandate for masks unless a person can tolerate them and want to wear them. It's very tricky with kids to mandate masks. It just, not feasible, not practical, and causes a lot of disturbance.
I agree with you on the mask, Dr. Era. I can't imagine having a class of primary class or any class. I mean, the masks would be dropped, and they might be less sanitary than not having a mask. Or yeah, they might be just more of a hazard than just not having a mask at all. I guess if somebody had a really bad cold, but if it's that bad, they should be staying home. I just think it's so important that kids get to play together again, and that it's just very difficult. I know there's different solutions, like rotate the equipment and different groups and everything, but then how do you manage all those things? So I do wish you luck on that, and it's just it's like having a gigantic puzzle, and you figure out one, but then there's all these repercussions and pieces that don't fit into that one piece. So thank you for all your efforts in that. I just can't imagine the volume of work that you are going to have with that added to your workload, in addition to all the extra work you've been doing with COVID-19. So my appreciation to the staff also.
Thank you.
Okay, any other questions or comments? Hearing none, do I have a mover and seconder to receive Dr. Era's reports?
Peabody?
Peabody? O'Leary? Is anyone opposed? Okay, that's carried. Thank you. Can I get you to scroll there, Sue, please? Okay, thank you. Corporate Services 8.1 financial report for April. Matthew.
Actually, if we can do this electronically, I've got Christy that will do the actual report. Okay. So we would need to unmute her, Connie.
I'm unmuted.
Hi, Christy.
Go ahead.
Hi, thank you, Mr. Chair. You have all received the April financial statements as part of your board package. The most important items to note are that due to COVID-19, program expenses have continued to be under budget as the programs were operating at a reduced capacity. And we started to pay out overtime in April, so salaries and benefits are rising to be above budget. that trend will continue over the next couple of months, and we anticipate an increase in program spending towards the end of the year. In the August board meeting, we will be presenting the May and June financial statements to ensure they're receiving more up-to-date information.
Good, thank you, Christy. Are there any questions or comments for the financial report? Seeing none, do I have a mover and seconder to accept the report as presented?
Edie,
Patterson.
And Sue? Anyone opposed? I consider that carried. Thank you. Overtime update. Thank you, Christy. Is
Yes,
this
thank
you,
you,
Matt?
Christy. Yep, that's for me. Actually, we'll, if you want to bring the graph up, because if you don't mind, Mr. Chair, I'll actually do the overtime update and the COVID-19 hours at once. I think it summarized it nicely in this graph that we're displaying.
Sure.
So in terms of total overtime that we've experienced to the end of payroll period 15, which is actually into July, we have paid out $235,000 in gross overtime. That covers all of our staff, with the exception of Dr. Era as CEO. Then beyond that, you see on the graph the overtime, it's in blue. And then there's the piece that's directly attributable so far, and that's why it's on an interim basis. It's in orange, and then you have the total hours for the entire health unit. You can see a bit of a bell curve, and that's completely expected. So as this thing ramped up, so did our COVID and overtime. And as we have gone through to stage 2, now entering stage 3, you see the bell curve flowing down. But our number of hours are remaining fairly steady. I do expect that as we hit a potential wave 2 and some of the other opening questions, we will likely hit some greater overtime and COVID time. So this will morph and change as we experience whatever happens next in both opening of stage 3 and beyond as we get into schools, etc.
If I may, Mr. Chair, just want to mention that if we get a second wave, proportionately, it will be less overtime, because over the past 3 months, we have adjusted our programs in a way that allow our staff to have more time to basically wind down the overtime. Like initially, people went into overtime, then we changed into 7-day work schedule, which would allow people to have 2 days off during the week, and this would reduce overtime as well. So the second wave would be smaller than this wave overtime wise.
Okay, any questions or comments for Matt's report?
I just had a question out of interest about your 7-day week. So that was well accepted by all staff, and realizing that that was more practical, because the health unit is, there's no way with the COVID-19 you can have a 5-day week. There's so many issues. So it worked out well then. No opposition to that concept at all.
So it's only related to the COVID infectious disease team and the communication team, and the number of staff is not small, correct? And yes, there is no opposition. Rather, there is complete buy-in from the way I perceive it, because we're looking after their well-being as well, instead of people working 24/7.
Yes, that's what we found. Municipal staff off, except for, your CAO and a few on the weekends. But when I'm talking about office staff, they're used to that 5-day week, and that just wasn't happening at times during COVID. So good, that's great. Thanks.
I have a question, Mr. Chair.
Yes, sir.
I noticed that the obviously in the chart here, the number of hours dedicated to the COVID-19 pandemic increased dramatically, but the number of absolute hours didn't change dramatically. It's up some. So I would think that some of the regular activities that the health unit deals with were dispensed with or put off. Is there a plan to get back on track to catch up with some of those things that were possibly deferred?
Definitely, and these were not stopped because they're not important. Rather,
Oh no.
they have been stopped because of the pandemic itself. For example, inspection of restaurants. Because of restaurant closure, our inspectors are not going out to do this work, and now in the reopening, they're actually going overtime. Not overtime, rather increasing their effort to do it in a short period of time and allow all inspections to happen. For example, between January and July, there will be 2 inspections of a certain restaurant. One of them was canceled because of the shutdown. And the other one, instead of having the luxury of doing it over 3 months, any day we want, we wanted to do it as soon as we can to allow that business to open. So that's an example of an activity. There are other activities that have stopped. For example, the immunization in schools has been stopped because schools are closed. The dental clinic, all dental clinics are closed. We only allowed it to open for the emergency dental because no other dentist in Grey Bruce can provide emergency. So we have been actually providing that service. So you're correct that the COVID response has upped, but the total number of hours have not because of the closure of many businesses that we service.
Thank you.
Okay, other questions or comments? Okay, hearing none. Sue, can we go back to the main screen? Okay. So do I have a mover and seconder for Matt's report?
Point 3.
There's still one more, Mitch, pandemic
Oh.
pay initiative for Matt.
I'm sorry.
That's okay.
That's the only thing I do wrong today. I think I'm doing okay.
That's right.
Okay, Matt.
Okay, so this is a initiative from the Ontario government where they're paying frontline workers, is predominantly from the Ontario government's perspective aimed at, I'll say, direct healthcare. We are in frontline. We are included in this, but it is restricted by the Ontario government to nurses and nurses only, and to very specific actions. And it's essentially those who have a greater risk of, I'll say, contact or exposure to the COVID-19. Things like swabbing, needle exchange programs, our immunization clinics, if we are having any active screening. So those are the 4 general spots. And for our nurses, irrespective of what the other professions are, the actual pay itself is predicated on the amount of time that those particular profession was engaged in doing those services. It's an extra $4 an hour. And based on the number of hours, if you go over a limit, and it's $100 per 30-day cycle, 100 hours per 30-day cycle, then you get an extra $250. We are just in the midst of going through the process with the nurses. We're anticipating that somewhere around $10,000 will be paid out, but that's just an anticipatory. That would give that report to the board so you saw what we're doing.
Okay, questions on that report from Matt? And the final one, COVID-19 time committed.
So I included the, Mr. Chair, 8.2 and 8.4 together on that previous slide. So I talked both about total amount of overtime paid out so far and the time committed to COVID-19.
Okay, so why don't we take 8, 2, 3, and 4 and just roll that into one report for acceptance. Do I have a mover and seconder?
O'Leary.
Thank you, sir.
Edie.
And anyone opposed? Thank you. Okay, 9.1, board remuneration discussion. Is that you, Matt?
That is me, Mr. Chair, and I'm just waiting for Sue to bring up. There's a PowerPoint to be. So there's, and I'll say this is being brought forward because there's a number of, I'll say, board members being drawn into many discussions that fall outside of our standard board meetings in executive or committee meetings. So one of the thoughts we had was that with that in mind, irrespective of who they might be, we have an existing pay scale, and that is for those meetings, it's 85 for a half day, which is up to 3.5 hours, or 150 for a full day, which is anything beyond those 3.5 to 7 hours. Those hours are inclusive of things like preparation time, travel time, the actual meeting itself, and if there's any subsequent follow-up. So beyond the specified meetings, we started to think about, okay, so how do we deal with some of the other things that have arisen, unfortunately because of COVID, but it could be over a number of other potential scenarios as well. So we thought we'd present the opportunity to consider an hourly rate for engagement and do that on a monthly basis, so that the iterative cycle would be, how many hours were spent in March, and then multiply that by a particular rate. Giving you sort of two rates to consider if this is something for consideration by the board. So starting at the average rate, which is, you can imagine that if you've got a fixed rate of number of hours and you're getting, a range of hours that are moving, so the first half day, so up to 3.5 hours, your first hour is pretty expensive and your last hour is pretty cheap, comparatively speaking, and the same exists when you go to a full day. So the average rate, I'll say, is a bit of an indicator, but if I use it as the top rate, so if we pay 85 for 3.5 and 150 for 7, what does that work out to? And that range is actually much narrower, maybe a little more indicative of the effort, et cetera, that needs to be taken. We're recommending the $24 per hour paid out on a monthly basis, but it's really meant for conversation and for the board's consideration.
So, Mr. Chair, if I may just summarize the couple of questions in the report. It really started with the fact that during this pandemic, the operation of any organization has changed drastically, including the operation of the support that the board provide to their employee, myself. And I found myself speaking with different board members to gain insight or advice or both multiple times. And looking back, the staff has been compensated for the overtime, but the board has not. And so the first question, is this of interest to have that hourly rate or not? And the second question would be, if yes, the second question would be, what rate and how would you like it to be applied on monthly basis or on quarterly basis? And this is just one option of recommendation in case the answer is yes to the first one.
Okay, thank you, Dr. Era. So discussions.
question, Mr. Chair.
Yes?
Matt, I'm wondering, have you done any kind of analysis to see what the overall impact potentially could be financially to the health unit if we adopted, say, the 24-hour monthly rate for, time spent outside of board meetings? Yeah, given past history.
Thank you for the question. Past history has been very small amounts of time on an annual basis. Less than 20 hours would be my estimate. I would say since COVID has arrived, I think that has to get blown out of the water, to be frank.
My anecdotal estimate, just looking back on the previous time, it's relatively higher than previous years, definitely higher. However, in terms of expenses for the health unit, I believe it will be minimal. It is almost negligible. There are different ways we consider it. If your answer is yes to this, how we can document this, because people didn't look at their time. And probably the most practical one is looking at the phone bill for my cell phone, because I've been contacting most people through the cell phone, and it's quite straightforward, an Excel sheet format to see what's the total is. So if this is of interest to get the exact numbers before going forward, we are able to do that.
Another question, Mr. Chair.
Yep, go ahead.
When was the last time the full day rate or even the half day rate was reconsidered?
My time. And this rate since-
8 years.
The answer from the board admin is before her time, if it was considered.
Well, she's pretty young, so that might mean not very long ago, but
12 years.
12 years. So I'm just wondering, I'm talking out loud here, thinking out loud. Is there an opportunity here to bump that up for a meeting, knowing that there is going to be, some outside of meeting time expended? And the other part of my question is there a bump up in pay for the chair
There isn't right now.
currently?
No, there's not right now.
So currently the chair does not make any more than anybody else.
Right.
That's correct.
I'm wondering if maybe that should be a consideration, because obviously the chair, like in most instances of councils, the mayor, and other committees, the chair typically does spend more time outside of meeting time.
So again, your question starts with how long has been the consideration. Really, even if it was longer or shorter, the fact that this pandemic is of the caliber that comes once in 100 years, I don't think we're going to find the previous precedent for it in our policies. And I totally agree with you. I have been in communication with different board members. The chair I have been in contact with every single day until the first wave ended a few weeks ago. Even the first stage, we were still contacting every single day. And sometimes, a long period of time, sometimes it's a 10-minute, 15-minute chat, but it was literally every single day.
I think it's good for consideration.
Mr. Chair?
So yes, it's good for consideration, I should say.
Mr. Chairman, it's Al. I think in due respect to Mr. Mills' comment, I think it's two totally separate issues. I think if you're looking at doing the per hour for what's going on right now is one thing, but I think looking at the half day or the full day is a totally separate report to come back, maybe comparing to what other health units pay or whatever.
This is Ann.
Go ahead, Ed.
I agree with Al. I think we'll keep the other suggestion separate. For myself, if Dr. Era, if you phone me, once in a while, I don't think it's any big deal. Myself, I'm happy. I'm on the board. I consider it one of my duties, but if you were phoning somebody on a regular basis, like, so maybe you could kind of have each month, you know, if it gets to be more than once a week with a board member, I don't know whether that's too complicated, or some timeline, like it's nearly every day, say with your chair or vice chair. But I think once it would pass a certain threshold, then this could come into effect of $24 per hour. But I just feel most of us, with any job, you're going to have phone calls, and not just at the board meetings. So I don't know if that's an idea or not, but I would be more than glad, say, Dr. Era, if you phone me about something, which you have, and you've phoned other board members, but I don't think you have phoned, you know, more than once a week or just a very short time. That's, you know, we're not going to get down into half hours or 10 minutes or things like that. But if you're having an hour conversation with somebody on the board on a regular basis, 2 or 3 times a week, then I think it's more for that type of call instead of the short 10, 15-minute calls, maybe once or twice a week. So that's just my opinion.
Other comment?
Mr. Chair, if I may, and there is another layer to it. There are certain calls to the board members in their capacity as a mayor versus in their capacity as a board member who, you know, providing advice. And, you know, whether it's for COVID or not. So there has been phone calls about a question that would support the municipality in the capacity of mayor. I wouldn't think this is included in this, rather it's separate.
I agree, Dr. Era, because like for me as mayor of the municipality of Kincardine, and I don't know how everybody else is paid, but you usually have kind of a base salary as mayor, and that's expected as part of your job. As if it's something pertaining just to an issue in the municipality of Kincardine, then that's included in my mayor's salary.
Other discussions?
Yeah, it's Brian. I guess I could throw in my opinion. I really don't feel like we should be making any changes. I know that the one person here that's doing more work than anyone else in Graham Bruce is Dr. Ara. So, you know, if we're not boosting him, we're certainly not boosting anyone else. But I would agree, I know it's a separate discussion, but I totally agree with the chair getting a boost.
Other discussions?
So this is Dr. Era, if I may say, speaking with the chair on daily basis, and you know, the chair is representing the board in those discussions. At times that there was so much uncertainty, especially before the wave hit. Again, there is definitely an extreme amount of time and responsibility with these calls that the chair has carried, and I think that should not be factored out.
Mr. Chair,
Yes, Mr. Miller.
I don't disagree with all of the comments that have been made so far. Certainly, if you want to push off the other debate for another day, that's fine too. I'm agreeable to management inserting the 24-hour or $24 per hour line item on our expense sheet. And if a member or the chair or any member of the board feels that they would like to claim some of that hourly rate outside of formal meetings, that's up to them. And if it gets questioned, that's up to them to defend it. So I would be fully in favor of submitting that or adding that 24-hour or $24 per hour line item in the expense sheet. And if a board member wants to submit 2, 3, 4 hours, whatever, that's up to them.
Okay, thank you, Brian.
Mitch, it's Al again. Not very often I agree with Brian Milne, but I am going to agree with him on this one. I think,
Hallelujah.
yeah, I think taking the management recommendation on the on that pay per hour simplifies it from a staff perspective. At least I'm assuming it is when they put the recommendation forward. So that then would cover certainly from the chair's perspective, the extra calls and everything that that yous are having. It would help compensate for doing that then.
So are you putting that forward as a recommendation then, or recommendation as presented, Mr. Millen?
Yes, I am.
So that's moved by Brian, seconded by,
Come
I'll
on, Al.
second it, Mitch, but I did have another question
sure.
or comment. I think that's good because sometimes the vice chair maybe gets in on a call as well. So it kind of evens it all out. And I'm trying to think, well, the executive committee, they get extra as well, or would this cover the executive committee? How does that work?
So the executive committee is already covered as a meeting.
Okay, that's good. But I'm sure sometimes, Dr. Era, if the chair is away or can't, be in on a phone call, which won't be too often, but then you'll go to the vice chair and that would take care of all that. So I'll support that recommendation. And as you say, you have to defend what you did. But I think that gives the opportunity for those that are in on longer calls.
You are correct in the fact that I would be calling the vice chair if the chair is not available, and sometimes both, just to depending on the situation, it could be related to an area where the vice would know more about the need.
Yes, so I think that's good. That would cover off our chair and vice chair for the extra work. And I think the question is it going to be retroactive or is it just for now going forward? I was just wondering about the timing of it.
My recommendation is retroactive.
Just a comment as well, like, I would think that, as far as defending this, I think as a board and its management, in this pandemic time, I don't think there would be any issue as far as defending it. And I think even in the recommendation, I mean, we could certainly as a board support this particular extraordinary situation so that it's covered, because there's definitely been, recognizable time.
And could these extra costs be recovered from the COVID-19 expenses, Matt?
It is part of it if it exceeds budget. Is that right, Matt? Please correct me.
There's two sides to the board expenses. The true board expenses are supposed to be paid by the county. With the exception of the chair. At this point, they will form part of our expenses for this year. Will they be allowed by the ministry? I'm not sure that they will. They'll just be expenses that the counties will need to cover, or be within our current cost structure.
Sorry, Mr. Chair, it's a really good question. We didn't discuss it in details. If I may just run my thoughts, why would it not be approved as COVID expense? It's directly related to the operation of the CEO MOH for COVID.
So if it's related to the CEO, for sure. So the board, remember what the audit said about board remuneration. was that it's supposed to be coming from the county. And that's a shift we're about to make moving forward, either later this year or first thing 2021. All board expenses, exclusive of the chair, should fall to the sponsoring county.
And again, that came out of the auditor's report.
That's correct. And that's a shift that we had decided that it will be in, if it's possible to do late 2020 or first of 2021.
Okay. Okay, any other discussions?
Mr. Chair, I wonder if it's worth running it by the ministry, because at the end of the day, it's a very exceptional circumstance that comes once every 100 years. And I see no reason why the ministry would say, no, this is not included in COVID, whether it's related to the board, related to the CEO, consulting the board or board members, either or. I would recommend exploring this before closing the door on it.
Okay, so why don't we just defer this? And I think too, from what I'm hearing as well, to have a look at the per diems or remuneration that we have now. And I think, Sue, going back when I was on the board in 2007, I believe they were the same rates as they are today. So that's going back 14 years. So I think to do due diligence, I think we should be looking at having a report coming forward just to see what other health units are paying, just to keep up with the times. And if it's the same as others, then at least we know moving forward. So for the mover and seconder, is it okay to defer this report and have it come back next month?
Just for clarification, Mr. Chair, what exactly is the report going to speak to?
I believe from what Dr. Ayer is saying, he was going to get verification from the ministry whether these would be COVID-19 related expenses.
But would that have any bearing on the rate of remuneration to the board? I mean,
no,
he can investigate that. I mean, I'd certainly encourage him to do that, but as far as the actual rate of remuneration, I'm not sure that decision or that answer would have any bearing on it, would it?
Fair enough.
But I'm fine to defer this if you want to bring back a full report on level of, meeting rates, hourly rates, all that kind of stuff. What are other boards doing? I'm fine with that.
Okay. And
I'm fine either way. I'm fine, whatever everybody wants to do. That's fine. If you want to defer, that's just fine.
okay, any other discussions? All those in favor?
Sorry, Mr. Chair, this is Dr. Ayer. I think there has been a fulsome discussion, and I think there has been agreement that there is a need for this. Like Mayor Ellen said, exploring that extra part, whether the expense will be covered by the ministry, the county, or other, really is, it's not pivotal to the decision. Just my thought.
Okay, thank you. So there is okay, let's deal with the management recommendation that's been moved in second. It's been discussed, so we'll put it out there for a vote. Anybody opposed to the recommendation as presented by management? Hearing none, that staff or the management recommendation be accepted. Okay. Sue?
Yes. Oh, sorry.
Sorry, yeah.
Sorry.
Then there's a page 2.
Oh, sorry. Did I take it down too quickly?
So
You did have page 2.
There's a page 2 for everyone.
Okay, the second item is the location of the August board meeting. So typically in the past, we went to the chair's home municipality, but what are folks thinking? Obviously, we're in different times now, and I guess we're just looking for direction if we do this we're doing today.
So, Mr. Chair, there was a second part to that item that Matt was talking about.
Oh, sorry.
And Mr. Chair, this is information that we think we need to bring for transparency to the board. There was an error in processing some of the previous meeting and event payments that go back to 2019 and into 2020. And this relates to whether it was a half day or full day and the entitlement. Excuse me. So there were 4 board members that this did affect. And between those 4, there was a total of $1,820 that were paid. This has already been paid to those particular individuals and communicated to them. And so that we also note that this will appear in our 2020 report disclosures sent to respective authorities. And that's typically county and CRA.
Okay, thank you.
Mr. Chair, if I may, this error is also connected to the error that led to the minutes from the executive meetings coming later, and that will be discussed in camera in more details.
Okay. Do we want a motion to receive this report as well? I think we should. Mover and seconder.
O'Leary.
Seconder. Ann?
I will second it. Yes.
Okay, any further discussions? Anyone opposed? Okay, that is carried. Okay, sorry, going back to 9.2, the August Board of Health meeting. What are folks thinking? Just continue on doing what we're doing, or try to have, are you thinking in person, Dr. Era?
So usually the August meeting is held at the municipality where the chair is a mayor. And just to be complete, we usually discuss this location. In the new stage 3 regulations, we're allowed to meet in a group of 50. We are way less than 50. If there is a space at the horseshoe at the location to allow for 2 meters distance, that might be totally appropriate and safe. And the decision is for the board to consider.
Okay, thank you. Discussions, comments?
I think at this time, till we see how stage 3 goes, how everything goes, I think a Zoom meeting's fine myself.
Other thoughts?
I'm good with this. This way I don't have to wash my hair. You don't either, Mitch.
No, I know. Yeah, I'm actually okay with that too, folks. I think can you hear me?
Yes.
Sorry.
Now we can hear you.
Yeah, I think I'm good with just having a Zoom meeting in August as well, unless somebody strongly opposes that and wants to physically get together.
I would agree.
Mr. Chair, it's Al. Are there any councils that are back to meeting somewhat to the old format? Or is everyone still doing Zoom meetings?
Owen Sound's back in the chamber.
You are back, Brian?
Yeah.
Southgate not.
Okay, no, I totally agree. I think doing the Zoom meeting still is probably the preferred way for right now until we get a little farther down this road.
And on that note, for Matt and Dr. Era, the ministry has said that Zoom meetings continue on. I'm just thinking in the Januaries and Februaries of travel throughout Bruce and Grey counties that might be a thought of having Zoom meetings for January and February to keep people off the roads. But that's just looking ahead. But I just thought I'd put that out there, that if we have the ability to do that.
I think that's a good suggestion, Mitch. You know, some people are coming from quite a distance, and it can be stormy in one location, really stormy. Same thing at the county when, you know, if it's really storming in the peninsula and northern part of the county, you know, that'll be something to consider. It's a good idea and less risky for people. It's hard to call, but it's a good discussion to have.
Okay, so
Mr. Chair, I see, if I might, I see Nick's comment there that they're meeting in the chambers without the public. And I presume they're streaming it as well, but that was part of the concern in Southgate, at least, was that how do you host the public at a public meeting, for instance, if you have to, you know, limit the number. I see they're not streaming it there. Thanks, Nick, for that. But
they do
we just decided that it was easier to have a Zoom meeting and then everybody has equal access to the meeting without restrictions.
Yeah, that's what we've been doing, Brian, at here in Kinloss as well, and the county. Okay,
Still you can still bring the public in. So what do we do at the Board of Health? The press, the media, do they come in on the Zoom meetings? Or do they just get the minutes? Or how does that work?
So they get the minutes, sometimes they join, and in all cases we're streaming as well.
Okay, good, thanks.
Okay, next item of business is to go into closed. So I need a mover and seconder to go in.
Sorry, Mr. Chair, there was the amendment item.
Oh, sorry, 9.3, sorry.
Right, so it's an initiative that might be very useful for two main reasons. It's similar to the resilience training that first responders would receive to reduce the risk of post-trauma and other issues. We are proposing or working on a session for first responders to be resilience to be provided to local political leaders, mayors, and CAOs as the fact that they have been first responders in this emergency. There is a lot of stress that is inherent in the subject, and there is responsibility, and such training might have not been provided to them unless they were involved in fire, police, or EMS services before. And the idea was really proposed by Nick Sandris, and to have a component in it related to reconciliation recommendations with the indigenous tradition. So we're planning for a session where we'd have two types of presentations. One, Western knowledge about resilience, and the other one is related to the indigenous tradition, and that both of them would support the healing, would support building resilience. And we have a plan to disseminate it, invite people to come to it. This item is just for update for the board. I know I have chatted with the chair about this before, and we are working on formalizing it to a session. At that time, we will disseminate it.
Okay, thank you, Dr. I know, Nick, you were trying to get in. He says he's being muted even by phone, Sue.
Connie is just looking at that, I think, right now.
Okay.
Connie, can you hear me?
Yes.
Thank you. Thank you for unmuting me. I figured out that's what was wrong. I would just like to say thank you to everybody on here, and you know, it is good to see everybody through the computer, especially Anne. I haven't seen her in a couple of years. Anyways, further to Dr. Ayers' discussion here, I think it's important to recognize the fact that we as politicians are also just as important on the front lines in protecting our communities and members of our communities as well at large. And when we're looking at this, the anxiety that goes through each one of our councillors, chiefs, mayors, CAOs, CEOs, we're able to protect ourselves, but not fully. And I think coming from as a fire chief, as a first responder, and a former member of the Canadian Armed Forces, I think that it's important to recognize that we all face these stresses, and that we're not immune to those stresses. And what I looked at was what is going to be the post-traumatic stress that could come out from COVID-19 for ourselves as politicians and mayors and such. And how do we address that? The anxiety level doesn't just come from, it's not just from our end, it's also filtering down into teachers, nurses, paramedics, and others that I've spoken with over the past weeks and stuff. And so this was just a starter to learn to see what Western science can complement, or Indigenous knowledge can complement Western science, and talk about the real truth and reconciliation of all of this, and how we're not immune to this. This isn't a non-reserved versus a reserved situation. This is a global pandemic. And if it was successful, that we could possibly build off this in the future to hopefully address mental health and the opioid addictions that are faced globally throughout our communities as well. So this is just a start. This is just my brain that's starting to kind of unravel. And I thank Dr. Era for taking the time to listen to me and shoot this out at him and see where this may fall. I think that there's great things that can be done, and I think that we can do it jointly, like I said, with Indigenous knowledge and Western science, and walking down this road parallel. Miigwech.
Well, thank you, Nick. And obviously, as politicians, we've all felt that stress. So I think it's a really good opportunity for First Nations and for the two counties to get together and have a discussion, because politicians, it's a tough job we have. And I do want to recognize our CAO and our senior staff members at all of our municipalities, and right down to our first responders and everyone. This is it is a stressful time and unprecedented, and we can't forget our families either. We take this home to our families, and so it is far-reaching. So, anyways, Nick, very well said, and I look forward to the opportunity, Dr. Ayer, for us getting together and having this discussion. Okay, other comments before we go into closed? Okay, mover and seconder to go into closed for personal matters but an identifiable individual. There's one item there. And 10.2, information supplied in confidence by another level of government. There's one item to discuss there. Do I have a mover and seconder to go into closed?
Milne.
Miller. Leary. Anyone opposed? Okay, thank you.
So what's the deal again here, Mr. Chair?
To close off the live streaming.
Reports or
Hello?
Hello?
I can hear you now, Brian.
Oh, okay, all right. I just noticed there's 2 or 3 items in the agenda here that there was no reports or presentations ahead of time in the agenda. And it would be really helpful if we had those in the agenda with some time to review them and think about them. Just a small item.
Okay, thank you, Brian.
Mr. Chair, if I may mention, and just to provide some information and get direction also, we have been trying to send the agenda as close to the date as possible, just because there are many moving parts and developments. We will include all the reports like the request asked us. No question, we can include this. But do you prefer to receive the package a week before, or like we have been doing a couple days before?
For me, a couple days before is fine. I mean, the agenda is fine, but my point was, I'd like all of the presentations in the agenda, regardless of when it shows up.
Certainly.
Thank you.
I'm just, I think in normal times, that's a reasonable request, but I'm just mindful of sometimes with the staff with COVID-19, maybe it's not possible with time constraints. You know, you can try, but with time constraints to get, say, a PowerPoint finished or whatever. Most times it is okay to have the agenda just a day or two before, because we're meeting at the end of the month. And I think that's a good choice of meetings, because we don't usually, there's just certain times we do have municipal meetings and council meetings, county council meetings in the last week of the month, but it's very rare. So I'm fine with a couple of days as well, but I'd like to give some leniency on till after the big part of the COVID crisis is over. It's nice if you can have all the reports, but I understand if you can't with all that's going on right now, especially the opening up of school and everything, and phase 3.
Good. Any other discussions? Sue Brown, you're having lunch delivered to all of our homes in the next few minutes.
I was going to ask if you all wanted me to start doing that.
Anyways,
Appropriate beverages as well.
Yes, exactly. Well, again, Doctor, thank you for all you're doing for us, and all the senior team, Matt and Sue and everyone. It's a heck of a job you have, and you're doing a heck of a job. So thank you again, and everybody please stay safe, and we will talk soon. So a mover to adjourn.
Milne.
Thank you, Mr. Millen. We are now adjourned.